Have you or a loved one ever had to save up money for a needed surgery? Well, according to a survey taken from Becker's Hospital CFO report, about 64% of Americans avoid or delay treatment due to the cost of medical care. This is one of the many reasons on why the American government should provide socialized medicine. I am hopefully going to persuade you on why government should pay for our health care. There are many advantages to socialized medicine. Socialized medicine prevents citizens from going bankrupt while attempting to cover medical expenses. Government-run healthcare would also be more equitable because treatment would not be dictated by what a patient is able to pay for. This would in turn save lives because patients would not have to delay life-saving treatments due to concerns over the cost of it. To begin, socialized medicine makes healthcare more affordable for the average citizen. The government would cover the cost and allow for the people to save their money for other important payments such as mortgage and groceries. Citizens would not have to worry or stress about where the money for their next medical visit is going to come from. High stress levels are also one of the leading contributors to many common heart diseases, which would only add to hospital bills. Early childhood care would prevent future social costs, including welfare dependency and other related health issues. With the use of socialized medicine, children and infants would be able to get the care that they need to decrease the chances of the child being welfare dependent as they grow older. And their guardians won't need welfare themselves to pay for the child's medical expenses. Socialized medicine would benefit the economy because doctors would only have to deal with the government. According to an interview with CMS admin Seema Verma in an article by Modern Healthcare, that providers are upset with private insurers too, thanks to increasingly onerous administrative burdens such as prior authorization and quality reporting. Doctors spend more time communicating and clearing with insurance companies than they do caring for the actual patients. Patients are also dissatisfied with insurance companies due to the high cost of insurance and worries that their claims will be denied. United States News reported that for most Americans, our health care is tied to our employment, and because of this, millions of Americans are losing their health care just when they need it the most. Economics predicts that health insurance premiums will likely decrease by 40% in the next year due to less payers and more who are in need of care. Due to the pandemic, many healthcare insurance companies are having to increase their prices because people are unable to work, which is in turn making healthcare more expensive to the average American. In this graph that I found also on Becker's CFO report, you can see that the leading cause of personal bankruptcy in America is medical issues over all other causes, standing at about 66.5%. In continuation, more affordable health care would mean patients would have 24/7 access to medical treatment. This allows for hospitals to provide more care to people from all aspects of life, including those who work night shift and who may require a visit to the emergency room instead of opting for simple care because some healthcare providers are not open. This would also mean that patients would not have to wait until the local health center is open, nor do they have to pay extra for an off-hour visit from the doctor. An example of this would be the Student Health Center on the VSU campus, which according to the hours posted on their website only remains open from 8 to 5 with an hour break in between for lunch. This puts them at being opening and functioning for about 8 hours during the day. This becomes an issue when students need immediate medical help later on in the day or at night when the health center is no longer open. Furthermore, socialized medicine is fairer and more impartial than our existing healthcare systems. If the government provided healthcare, patients would have access to the top-notch doctors and treatments without having to save up a large sum of money. Medicine and treatments would be the most equitable because socialized medicine eliminates administration costs by eliminating the need to deal with private insurance. It would also force hospitals and doctors to provide the same amount of standard care at the same low cost. Socialized medicine would also cause a decrease in contagious diseases, which is the leading cause of a widespread pandemic. If it's going untreated, the disease is going to spread more and increase the chances of contaminating millions of people. Socialized medicine would also allow for every American to be able to receive health care benefits no matter what the circumstances or social issue status. In conclusion, the healthcare system would not only be more accessible, but also more beneficial to everyone rather than just a small population. Patients can worry less about how much their savings are when it comes to healthcare treatments, and will also be able to have the best treatment ready for whenever they need it. So the next time you pay a visit to the hospital, think about how socialized medicine can benefit you and your health.